So the Premack principle was proposed by David Premack in 1959. It's when high-frequency responses are used to reinforce low-frequency responses. A child is given access to chocolate contingent on whether they eat their peaches. So in this case, eating peaches is a low-frequency response and eating chocolate is a high-frequency response. This principle can be based on the first-then model. First you eat your peaches, then you eat your chocolate. So the goal is to reinforce low-frequency behavior with high-frequency behavior. You need to determine what your reinforcers are, and this can be done through one of 3 types of preference assessments. You can ask the client or their family members what the client likes or present a pre-task choice. You can conduct a free operant observation. These can be contrived in which you lay out items and activities in the environment and observe the client's engagement with these items or activities. Or you can observe the client within their natural environment and see what types of things they engage in. Or you can do trial-based methods. So in a single stimulus, you observe the client's engagement with a single item or activity, and you take data on whether or not the child rejected that item or activity or they approached it. Record the frequency and collect duration data. You can also do paired stimuli where you present 2 options, again collect similar data, and in a multiple stimuli you just increase the array to 3 or 4 items. You also need to determine the effectiveness of these reinforcers, and this can be done through concurrent schedules, multiple schedules, and progressive ratio schedules. In a concurrent schedule, you're comparing 2 stimuli to see which one produces higher frequency responses. Will Sally eat more cubes of cheese when reinforced with eating chocolate, or will she eat more cubes of cheese when reinforced with eating cookies? In multiple schedules, you have 2 or more component schedules that are present, and the SD is delivered in one of the schedules, and consequences are contingent on delivery of the behavior. Whereas in the other schedule, the consequences are delivered independent of that behavior. So they're on a fixed time schedule. Progressive ratio schedule, you increase the reinforcement schedule. So you're basically looking to see how hard is this client willing to work for this reinforcement. How valuable is that reinforcer to them? Welsh, Bernstein, and Luthans published a study in 1992 which looked at increasing employee performance on less desirable tasks. In the baseline condition across employees A, D, C, and E, we can see that there's a greater rate of errors produced on less desirable tasks, where in the contingency conditions, where the Premack principle was being used, the number of errors being produced was much lower. Mitchell and Stoffelmeyer conducted a study in 1973 which used the Premack principle with inactive schizophrenic patients. These patients were asked to uncoil copper wire from coils, and in the baseline condition the levels were 0 for both patient WL and patient PM. But in the intervention condition, when the Premack principle was being used, those numbers increased, and they were being reinforced by sitting, which was a high frequency behavior for them. The principle can be used in the classroom setting as contingency contracts, and this is something Brenda investigated in 1996. The students themselves asked if they could go outside after they finished their work, and this established the reinforcer. So motivation to go outside increased their performance on classroom tasks. The principle, however, should not be used if the instrumental activity comes aversive. So if Johnny finds eating yogurt aversive, he will not care for what he's being reinforced with. So that chocolate, although it's highly preferred, will not be able to capture his MO to eat the yogurt. Thank you for watching, and please remember to complete the quiz.